First and foremost is focus on your core values, right? Just focus on who you are, who you want to be, because then your team will emulate that, which is important, right? So you've got the value of the practice is beyond you. You're creating something beyond you.
Welcome to Investment Grade Practices Podcast, where we believe private practice dentists deserve to get the lifestyle today while building an asset for tomorrow. Join your host, Victoria Peterson, to design the practice of your dreams and secure your financial independence. Let's get started.
Welcome. Today, I am talking with my very good friend, Vincent Cardillo. Vinny, welcome to Investment Grade Practices.
Vicki, thank you. So excited to be here and to see you and to chat with you. It's always a pleasure.
Vinny, you are the founder of the Maeva Dental Advisors. And what I know is that you work with the mavericks in our industry, the men and the women who are absolutely committed to building companies of integrity and value. And I love that your name Maeva sort of incorporates that maverick energy.
Yeah, that's great. That's what the team came up with. And the mavericks that we see, since we work with so many folks that their energy is around growing multiple locations, however, keeping it committed to their core values. So it's folks that are always stretching their boundaries. And our job is to work with them to manage the stretching of the boundary.
I love that. And on Investment Grade Practices, those are the things that we focus on. Is what do I do today so that I love my business that I'm working in, whether I'm working directly in it as an owner operator or a manager. You and I have been on both sides of those equations. So I love the company I'm in today and I'm building value for tomorrow. And I wish you could see Vinny's face. I think we're cosmic twins and our number one core value is fun. So I know today is going to be a ton of fun. One of the reasons I wanted to pick your brain is because you are advisor to DSOs large and small. I've known you for decades. I know you started out building one of the first DSOs and leveraging that way back. When was that? 1990?
95.
95. Wow.
95. It was a long time ago.
So the students in dental school today were being born when you formed your first DSO.
Yeah, that's right. That's kind of scary.
It is a little scary. But I think it also speaks to the depth of your knowledge. That's probably why you sit on the board of advisors for so many private equity firms that are searching for companies of value within dentistry. And that is what I want to pick your brain about today. So this is like an insider's look.
Great. Very cool. Excited. Can't wait for the questions. Hopefully I can answer them.
I'm going to ask you hard questions that I know you know the answer to. So what do you look for when you're purchasing a practice?
So that's a very interesting question because it depends. If the practice that we're purchasing or acquiring in our business model is to partner with dentists for the long haul, for the long term, they're going to be there. We're looking at perio, right? What's number one? What's their perio numbers like? Because if their perio numbers are, within range of the 30 to 50% of the procedures that hygiene is doing, we understand that they get that concept. However, if we walk into a practice and they're at 7 or 8% and they're going to be our partners, it's going to be a tough journey to get them to commit over and turn over this whole new philosophy of believing in perio. So that is a real important one. The second is, what are they referring out and what are they keeping in-house? And how excited are they about doing different types of procedures, be it implants, sedation dentistry, and, looking around at their reviews, how are they perceived by their patients? Do their patients like them? And the number of patients that they've seen in the last 12 to 18 months and understanding the nutrition rate. So we look at all those with a partner that we want that partner to have strong basis in those. Now, if there's an acquisition where the dentist is retiring and we know that we're going to have to accrue and bring in another partner dentist or another associate dentist, we're looking for opportunities. So we're looking for low perio because we know there's opportunities to increase the perio, right? we're looking for everything to be referred out because we know we're going to try and bring things in-house. So those practices have value to a smart operator, if you would. So those, there's two dichotomies there, right? Are we keeping this person, or are they gone? Are they retired?
You know what's great about this, because I know my listeners are in mid-career and late career. So if in your mid-career and you want to join a group or build a group, start living up to benchmarks and exceeding them. If you feel like you're late in your career and you're feeling like, oh my God, I've got to really fix up my practice and put a little lipstick on it before I sell it, that may not be the smartest strategy. It may just be to say, look, I got a lot of gold here. I'm not very good at perio, we're endo, oral surgery, sleep apnea, extractions, crown and bridge, prosthodontics, like all of that. And I've got a really loyal patient. There are practices where the patients are super loyal to the retiring dentist, and the location is branded as a dental facility. So you've got that mental repetition and pattern in the community.
Right. So what you're saying is correct. It's important to understand who you are. So when you are having a conversation with someone, you can represent it appropriately, because someone may want to take advantage of your knowledge base of your own practice.
And you helped me a lot in Neighborhood Smiles when I had that group.
I did.
You did. It was more than just having fun and buying you dinner. You helped me a lot. But I had 3 practices 15 minutes apart. One was high-end comprehensive dentistry into TMJ therapy, functional, sleep apnea, all of that, Botox, oral systemic. The other one was kind of bread and butter community, which had been fee for service. And we actually brought in more PPO because the younger doctor who needed to build up their service mix. So that was good. And then the one in the middle was known for emergency dentistry, and we barely had to advertise because people knew it was a dental building. When you came in from the parking lot, ours was the only door. It was the first door in the door, and all the other dental practices were down a long hallway.
Right.
So all 3 of them, only 15 minutes apart, had a different marketing strategy because of what worked and fit in their value equation. Is that what I'm hearing you say?
Yes. So in that situation, look, it's okay being as close as you want to each other. We used to own practices right next door with different names.
Oh, I love that. All right. Now, my next question, I'm going to split into 2 parts, because again, you're all about driving to value. So for anyone listening to the podcast today, what can they do today to increase the value of their company, maybe back to them as an ROI, as an owner? And then the second part of that question is, what can I be doing today to increase my value tomorrow?
Yeah. So it's good to understand, well, first and foremost is focus on your core values, right? Just focus on who you are, who you want to be, because then your team will emulate that, which is important, right? So you've got the value of the practice is beyond you. You're creating something beyond you. So to create real value and an exit, what we see is some doctors believe that, hey, if I create a $3 million practice with just me and 3 hygienists, that's great. It's good while you're working it because you're making a lot of money. But when you go to exit a practice like that, the individual dentist can't afford it. And the groups are afraid of it because you are a risk to them, because you're such a high producer. It's funny, right? That's going to be a negative to you. And they're going to say, look, you're a risk to me because you produce 2.5 million a year. I know we have 400 doctors and our average doctor produces 800. So I'm going to have a problem on my hands when you leave. So it's something to be aware of. So that would lead to bringing in an associate where you could spread that risk out and you're not perceived as risk. It's having a perio policy and following it and making sure your team follows it. It's not referring as much out. And you can recruit someone that wants to do all the things that you don't want to do. We see practices and doctors that are higher producers that are doing implants, that are doing sedation dentistry. If those are areas that you're not interested in, there's someone that's out there who wants to do it. And bringing that in, and now having a $4 million practice where you're doing 2 and they're doing 2, you've now increased the value, even though it doesn't make sense because you're producing less. But to the buyer, if you're a big practice, your only buyer is going to be a group. And these are the things that a group looks at and how they look at it.
You and I will have many, many interviews because I know how deep you can go on this topic.
Yeah, sorry about that.
You're scratching the surface and there's so much gold. And thank you for staying tight to the topic, because each episode I want the listener to be able to walk out and go, okay, that one was about building value. And right. So far, I'm taking notes. I'm taking so many notes. Number one, I love it when you said, focus on your core values, who you are and who you want to be. Your team will emulate that. And know that the value of the practice is beyond you. That sounds so common sense, and yet it's not.
Right.
So build your productivity, yes, and build it beyond you, because that adds more value. Did I get that right?
Yeah, exactly.
Oh, that's awesome.
Because it's all about growing people, right? That's where the value is, right? If you're growing better managers and you're growing better hygienists and you bring in an associate and you grow them. When a buyer, again, because most of your practice are at that higher end, you're going to be confronted with these group buyers, and they see a lot of practices. And if you're focused, when they visit, they will know.
Can I have you back and let's just talk about team culture on another interview?
Yes, for sure. I'm not sure if I'm that person, but we'll give it a whirl. And if you don't like it, you can delete it.
All right, my last question for you, and this is the most fun question. And so, what is the biggest mistake you see dentists managing their business in terms of creating an asset? What's some of the big mistakes that they make?
I mean, I think the biggest is really understanding their numbers and understanding their KPIs, right? Their key performance indicators. And we like to break those KPIs into 3 buckets. Their business KPIs, operational KPIs, and clinical KPIs, right? Your business ones are related to your profit and loss statement, right? How much are you spending on supplies? What percent is it? What percent is your team? Understanding what EBITDA is and tracking that EBITDA, because that's what people are going to buy you on in the future. So you can create that value every single month as you look at it and manage it. Your operational KPIs are more around, your marketing, how many new patients, what's the cost per patient, what's production per hour by provider, what's your retention rate, right? Those are your operational ones. And then your clinical ones are our perio percentage. How are we following our x-ray policy, right? That would mean that you'd have to go and do chart audits and check that the x-rays were there, or a new patient exam policy, that, what your expectation is of a new patient exam. Again, if you're there alone, that's fine, but your team needs to know what you expect for an exam, what you're going to be doing. And if you get an associate, you're going to review that with them. And you want to do a chart audit that reviews your clinical exam or your associate's clinical exam, along with any other thing that you believe in that's part of your core values that say, all right, you know what, for every new patient, we're taking an FMX and a pan and we're charging for the FMX. All right, great. I mean, we used to do that with 40 offices. Every single morning, I would get a readout that said, okay, you had 62 new patient exams this morning, and there were 40 FMXs and 58 pans. Well, something happened. What happened? Who didn't follow it, right?
That's awesome. And this is one of the reasons why I love working with you. We at Productive Dentist Academy, we're primarily in the solo practice space, but we grow the doctors to the point that they're really large, and then they've got to think about their exit strategy. And you're one of my go-to people for this. And it's just a pleasure to now put this in a podcast format and get some of this out there, because it is such strategic thinking. And we're so passionate about these KPIs that you're talking about, breaking it down, business, operations, and clinical. I don't know if you know this, but now Patty Suey and her team have a whole clinical faculty now. And they go, what is your philosophy of care? Like, what do you believe in? Are we serving the most underserved in the Medicaid realm? Are we serving blue collar, working class PPOs? Are we serving fee for service? What's the demographic? That's my philosophy of who I want to treat. What do I believe about technology? What do I, all of that. But then there's the standard of care, which you just articulated. That's my metric. So that's what I believe. But what really showed up and how is my team and there's a whole system. We thought, we'll just do a half-day program on that. It's probably a 4 or 5 month training with daily month.
Yeah. It's constant follow-up, right? And you have, look, the KPIs that you want to follow on your clinical and your operational side are really, whatever your core values are, you better have some metric for each one of those.
Yeah.
Right? Because how do you know it's real, right? And how does your team see that you're real about those core values? Well, you track them and you show them and you reward them, and they become believers because you're a believer.
Vinny, thank you so much for being with me today. You really bring to light the belief that, strong businesses, investment grade businesses focus on building the people, the profits, but you do it through this framework of purpose and passion. So thank you for being with me.
You're welcome. And thank you so much for having me, and always a pleasure to chat with you and see you.
All right. I know that my inbox is going to blow up. How do people get a hold of you?
You can give it my info. So it's Vin at Maeva Advisory, Maeva advisory.com.
So don't call him. Don't text him. Give him a shout out on his email.
Yeah, you could text me 413-433-2550. Just put a name.
Vinny, once again, thank you very much for sharing your philosophies on what makes a great investment grade practice.
Thank you for tuning in to this episode of Investment Grade Practices Podcast. If you find value in this episode, help us spread the word by passing it along to a dental friend, subscribe, and give us a like on iTunes or Spotify. Learn more about building your investment grade practice at productivedentist.com today.